Only 20% of a dental implant actually does all the heavy lifting when you chew. It sounds crazy, but the exact depth your dentist places that titanium screw completely changes whether your jawbone survives or melts away. In the dental world, there are basically 3 ways to place an implant: above the bone, exactly level with the bone, or buried deep underneath it. Placing it above the bone is the classic, safe route. The connection where the implant meets the fake tooth has a microscopic gap. By keeping that gap above the bone line, any bacteria hanging out in there cannot easily reach the bone to cause inflammation. Then you have placing it exactly level with the bone. For a long time, dentists just accepted that doing this meant the patient would lose about 1.5 millimeters of bone. It was just considered normal wear and tear, especially if the patient had naturally thin gums. But burying the implant deep under the bone is where things get really interesting. From an aesthetic standpoint, it is the ultimate way to make a fake tooth look totally natural coming out of the gums. But the real magic is mechanical. Your jaw has hard outer bone and spongy inner bone. The hard outer bone actually hates heavy compressive forces, but the spongy inner bone handles it like a champ. When you bury the implant deeper, you shift all that chewing stress away from the fragile outer bone and straight into the spongy bone that can actually take the hit. There is a massive catch though. You absolutely cannot just bury any random implant. If you take an older style implant with a basic connection and bury it, the tiny micro movements from chewing act like a toxic pump. It will literally pump bacterial waste straight into the bone and destroy it. To go deep, you need a very specific design called a Morse cone connection with platform switching. This design locks everything down tight and creates a safety zone that keeps the bad stuff away from your bone. You also have to attach the final piece on the exact same day as the surgery, so you never have to open the gums back up and disturb the healing process. An implant system is exactly like a long-term relationship. If you do not understand exactly how it is built and how it handles pressure, you are just setting yourself up for a painful disaster down the road.